Did you have any takeaways from episode 62 about trauma-sensitive care with Taelor Millsap? Today, I'm going to take just a couple minutes to discuss a few of the takeaways that I had from the episode. So if you haven't listened yet, go listen at otforlife.com/62 or on your favorite podcast player. If you're interested in occupational therapy, this is the place for you. This show aims to explore our profession by sharing who we are and what we do. Because for us, occupational therapy is more than just a job. Hi, I'm Sarah. Welcome to OT for Life. To start, I wanted to talk a little bit about what prompted me to do this episode and the impetus behind sharing a few of my takeaways from the recordings with guests that I bring on the show. After Taylor's episode, I had an absolute outpouring of comments from people who had listened. And one of them really stood out to me and got me thinking. And I felt like it was one of those things that was just important enough that I had to share with you. So in the episode, I made a comment in reference to one of the stories that Taelor shared about, especially when our clients are in a heightened state of arousal, whether it's dysregulation of their sensory system, whether they're experiencing some sort of emotional reaction to something that's going on, or just for any reason that our clients seem to be just a little out of sorts and really not able to listen to what we have to say and really just aren't able to take in anything that seems to be going on within the session at that moment. And so I made this comment about when our clients are in these states that we need to talk to them on a cellular level. We need to talk to their bodies. Yes, we can be using our words, but a lot of times the words they're not able to understand. They're not at the mental state. They're not at the emotional state to even begin to comprehend what it is that we're saying. And so rather than firing all these verbal directions at them, we as occupational therapy practitioners need to take a step back and really talk to our clients' bodies. We need to talk to them on this cellular level. And I had somebody reach out to me that said that comment really, really stood out to them as a takeaway from the episode. And it got me thinking. And we didn't really even talk about mentorship in the episode, but being that this comment stood out to one of my listeners, it made me take a step back, talking about taking a step back here in our sessions, and remember where this comment came from. And this comment was something that I learned really early on as a practitioner, and it came from my first mentor. And I remember one day I came to her, and this had to have been within the first 6 months, maybe a year of me practicing. And I was sharing some frustrations that I had with one of the kiddos that I was working with. And I just felt like everything that I was doing, I could not get through to this kiddo. And I was pretty much just hitting my head against the wall, trying to figure out how to get through, how to help this kid, and how to get this kid to start making progress within their therapy session. And I remember my mentor looking at me and making the comment that you need to talk to your clients on a cellular level. And I remember thinking, what? What does she mean by this? And she explained it to me that a lot of times when our clients are in this heightened state of arousal, they're not listening. They're not going to listen to verbal directions. And so you have to talk to their bodies. You have to talk to them through their body. You have to get them grounded before you can even start to make any sort of progress or get them to be able to do anything functional within the session. And since that day, this comment has stood out to me and is something that I pass on to my students and my volunteers and anybody that comes through as a mentee to me. And then again, when I brought it up in the episode, it just really highlighted the importance of mentorship within our profession. Being that I learned this lesson maybe 10 years ago and that I still draw from it and I still pull it out within my recordings and I still pull it out within my sessions means that it was super pivotal. And it's something that's really, really important. And that just shows the power of mentorship and making sure that we as practitioners, especially when we are first out of school, get that right mentorship to be able to set us off on the right foot. My next takeaway was realizing the significance between the big T traumas and the little T traumas. I think for me, going into this chat with Taelor, it was easy for me to picture the big T traumas, these big traumas and how they impact our clients and how they impact us as practitioners and really how they impact people as a whole. But I think so many times these little T traumas, these not necessarily smaller, but maybe less obvious traumas, and how they can actually have just as big of an impact, but often are completely overlooked and are not even seen. And it really made me stop and reflect on some of the things that I've gone through in my own life, and maybe how I've experienced some of these small T traumas without really paying attention to it. I learned so much in all of these episodes, and I remember Taelor started talking about a car accident. And about 13 years ago, I was involved in a pretty significant car accident. I was not seriously injured. My car was totaled, but I was rear-ended on the freeway by a car that was going way faster than I was. And I realized that to this day, anytime that I'm in a car and there is a significant decrease in speed, that there's like this abrupt deceleration, I have this physiological response. And all of a sudden, it like takes me right back to that day that I was involved in that accident. And I mean, it's crazy. I could be asleep in the passenger seat and my body will sense that decrease in speed and I will shoot up and it gets my heart going and I kind of have a little like mini freak out session. And I notice that I like, as fast as I can, I'm looking in the rearview mirror and I'm checking out what's going on around me. And it's just so interesting because I wouldn't necessarily think of that as this huge traumatic event, but it is definitely something that still stands out to me and is something that still impacts me to this day. And so it makes me realize the importance of understanding what trauma is, and also recognizing that while there are big traumas that are easily seen and easily noticed, there's also all of these smaller traumas that are really just as important and can have a huge impact on how a person is functioning that also need to be taken into consideration when we're working with our clients. My third takeaway has to do with medical issues and how they can also be traumas as well. Think about somebody encountering a fall and then having to have some sort of surgery, whether it's hip surgery or back surgery, or somebody that suffered from a stroke or a heart attack, somebody that unexpectedly ends up in the hospital. And how I think so often we think about it as just this experience, but we really need to reflect on it as that anything, even if we don't think it is, could be perceived as trauma within our clients. And that was another thing that Taelor talked about. It's not what we think as a practitioner or as a family member or a spouse. It's how it's perceived in each individual person. So yeah, also recognizing how medical issues, medical diagnoses, medical disorders, a lot of these things that happen to the people that we end up working with can be an extremely traumatic event for them, even if we don't think that it is. And my biggest takeaway from the episode, and I think everybody that reached out to me after they listened had this exact same takeaway, and it was almost one of the very first things that they mentioned, was Taylor's comment about connection before correction. And that comment stuck out to me when she said it in the episode. And even to this day, it still stands out to me in how important it is for us as practitioners, as healthcare providers, before we jump in and educate, before we jump in and change something that our client is doing, or share something that maybe they should be doing it a different way, or tell them what they're doing is wrong. Before we do any of that, we really have to establish the connection with our client. We have to establish that trust, and we have to establish that relationship before they will even be willing to trust us, to listen to us, and then to do what it is that we want them to be able to do. So yeah, that connection before correction is pivotal. And I loved that comment that Taelor made. Okay, I'm going to keep this short today. I just wanted to hash out a couple of these takeaways that I had. So in conclusion, my 4 takeaways for episode 62 are: number 1, the importance of mentorship. Number 2, that small T traumas can be just as impactful as the larger big T traumas. Number 3, that medical conditions, diagnoses, disorders, injuries can also be perceived as traumatic experiences. And number 4, connection before correction. Now, I want to know what your takeaways were from episode 62. What were your takeaways about trauma-sensitive care? To do this, all you need to do is go to otforlife.com/community and join in the discussion about this episode. It's free to join, and I can't wait to hear what your thoughts were about this episode. Thanks for listening to today's episode. If you like what you hear, here are 3 easy ways you can help support the show. 1. Head over to otforlife.com to find out more about any resources discussed on the show. Remember, that's OT4LYFE.com. 2. Share the podcast with a friend, colleague, or anyone interested in occupational therapy. 3. Subscribe to the show on your favorite podcast player so you don't miss out on any upcoming episodes. And while you're there, be sure to leave a review saying how much you love the show. Thanks again. I'll catch you next time, OT for Lifers.